vitamin D deficiency, foods, norm, hypovitaminosis, and excess of calciferol. Interesting about science and medicine, prepared by editors of a channel All Scientifica. Vitamin D, calciferol, is a fat-soluble vitamin with hormonal activity. Vitamin D2 produced by plants as ergosterol is called ergocalciferol, the conversion of which is stimulated by ultraviolet radiation. Calciferol is involved in the absorption of calcium and phosphorus in the ileum. Vitamin D3 cholecalciferol is produced from the provitamin dehydrocholesterol, which is found in the skin in significant quantity. Dehydrocholesterol is converted into calciferol under the influence of ultraviolet rays. Cholecalciferol from food is very unstable during storage and cooking. During the exposure of the skin, preferably the forearms, to sunlight in May, June, July, August, up to 10 international units of vitamin D3 are produced per square centimeter of skin, depending on skin color, melanin content. Dark, swarthy skin block most of the ultraviolet rays, so the production of calciferol is very low, while white skin produces more of this substance. On sunny day, human skin in the sun can synthesize up to 200 micrograms of vitamin D, while the body can produce about 5 micrograms of this substance from food. With the help of bile, calciferol is absorbed in the small intestine. Pancreas, liver, gallbladder, or intestine disease can reduce the absorption of this substance. Recommended daily intake of vitamin D. The recommended daily intake of vitamin D is 400 international units. Infants need twice the amount of calciferol compared to adults. People over 60 years of age are recommended to take additional amount of calciferol in the form of calcium and vitamin D. Women who have reached menopause need additional amount of calcium and calciferol. Calciferol hypovitaminosis. In children, vitamin D deficiency manifests itself as the following symptoms: rickets, characterized by abnormal growth and brittle bones. In adults, a lack of calciferol in the body manifests itself as osteomalacia, osteoporosis with a decrease in bone mineral density, weakening and fracture of bones. After 28-30 years of age, up to 1-2% of calcium is lost from bone every year, so osteoporosis may occur in 10-20 years. The following factors can impair the absorption of calciferol: anti-epileptic drugs, excess dietary fiber and gum in the diet, Hypovitaminosis of calciferol both in children and adults can lead to a decrease in the level of calcium in the blood, which is characterized by the following symptoms: feeling of weakness, muscle spasm, impaired muscle contraction of the head, and muscle excitability. A lack of calciferol in the body can manifest itself in the following symptoms: increased susceptibility to infection, neuromotor hypersensitivity, anxiety, muscle spasms, deformed legs in form of X or brackets, weakening of tooth enamel, deformation of a spine, decrease in height and weight, fracture of a femur and pelvis. The following category of people are prone to hypovitaminosis of calciferol and need an additional daily intake of calciferol. Vegetarians, people working in room with artificial lighting and not exposed to sunlight, patients with kidney, liver, thyroid gland disease, people who abuse alcohol, pregnant and lactating women, people taking the following medication: anti-epileptic drugs, laxative, alkalizing drugs for the treatment of AIDS, people who have reached the age of 60. Vitamin D hypervitaminosis. Large dose of calciferol can cause calcium and phosphorus to precipitate in the blood vessel, liver, lungs, and kidney. Symptoms of vitamin D hypervitaminosis are unstable thirst, diarrhea, general discomfort, skin and eye pruritus, itching. Food containing vitamin D. The food richest in calciferol are milk, yogurt, fish, eggs, butter, mushrooms. Fish oil is the richest food product in vitamin D and A. Product containing vitamin D: herring, salmon, fresh tuna, sardine in oil, carp, pike, trout, chicken eggs, black caviar, tuna and oil, bollets, mackerel, mushroom, pork liver, low-fat veal, braised lamb liver, boiled veal liver, butter, lard, parmesan cheese, camembert cheese, natural yogurt. Thank you for your attention. This material was prepared on basis on the channel All Scientific Attention. This material is for information purposes only. When observing various unusual symptoms, it is recommended to consult a doctor. Subscribe to our channel. Thank you. Bye bye.